Good afternoon and good evening, dear colleagues, ladies and gentlemen. I'd like to open work-from webinar titled Hepatocellular Carcinoma. I'm Dr. Choi from Seoul, Korea, moderator of this session, working at Jungwang University Hospital in Seoul. We have four internationally renowned speakers for HCC from all over the world. At first, I'll give you a brief introduction for HCC, and then Dr. Piscaglia from Italy will talk about ultrasound surveillance and diagnosis, and then Dr. Kono from UC San Diego, USA, will explain CUS LYRAS, and finally, Dr. Xie from China will discuss treatment by ultrasound intervention. As a first speaker, I'll introduce briefly about HCC. I have no conflict of interest to disclose with this topic. Here you see a map of cancer incidence worldwide. As you see, liver cancer is the most common in Eastern Asia and Sub-Saharan Africa. But interestingly enough, even in USA, HCC shows rising incidence from 1970s to present and shows fastest growing death rate. So HCC is really a global problem. HCC is the sixth most common malignancy worldwide and 6% of all cancer. But unfortunately, 5-year survival rate of HCC is less than 10%. But 5-year survival rate of early HCC is 75% because early diagnosis potentially enables curative surgery, radiofrequency ablation, or transplant. Here are clinical practice guidelines for HCC worldwide, including Europe, Korea, America, Japan, and Asia Pacific region. According to those guidelines, dependency of imaging technique is increasing for the diagnosis of HCC. Here you see a change in guidelines for the non-invasive imaging diagnosis of HCC. Since 2000 EASL guidelines has been announced, all guidelines in the world show increased use of dynamic ultrasound, CT, or MRI with confirmative diagnosis criteria, including hypovascular nature in arterial phase and washout in delayed phase imaging, and decreased use of biopsy and alpha-fetoprotein, and decreased size criteria for small HCC. HCC guidelines in the world, including Korea, Japan, Asia, USA, and Europe, were changed in 2018. So 2018 is a very special year for change of world guidelines. In addition, in 2018, as you see in this slide, CUS diagnosis achieved a major milestone by unifying LYRAS and AASLD, that is the American Association. LYRAS is a liver imaging reporting and data system developed by Dr. Sorin from UC San Diego and supported and endorsed by American College of Radiology. LYRAS is a comprehensive system for standardization of liver imaging in patients at high risk for HCC. Recently evolved radiologic techniques are changed from morphology, qualitative imaging to functional, quantitative imaging. Here is an example of functional quantitative ultrasound techniques using contrast-enhanced ultrasound. Treatment response can be assessed by quantification of perfusion parameters using CUS in cancer patients treated with anti-angiogenic therapy. As you see in this example, HCC treated with bevacizumab and evaluated by CUS. Lastly, for the treatment of HCC, hybrid fusion imaging such as ultrasound combined with CT or MRI is recently getting popular not only for the diagnosis of HCC but for the treatment using virtual ultrasound. This is my last slide. Thank you for your kind attention.